Hi! So may comment si Kalop siya, natatakot na raw siyang ituloy yung course niya dahil sa POV. Naku, wag. So may kwento ako sa inyo guys. Nung estudyante pa lang ako, I didn't like neuroanatomy. Meron kaming subject ng biopsychology sa UP dati na nagda-dissect kami ng brains, nagde-discuss kami ng brains. Hindi ko rin siya gusto. Basta pinasa ko lang siya para lang makapasa ako. Nung first year medical student, we discussed neuroanatomy. I didn't like it also. So sabi ko, naku, never ako maging neurologist. However, nung nag-third year medical student na ako, meron kaming preceptor na sobrang terror. As in, sobrang terror siya. Meron siyang hinaras na neuro-resident sa harap namin. Tapos kami rin, he made us feel stupid, parang feeling namin, parang wala kaming brains. So instead na ma-discourage ako, na-encourage ako, sabi ko, tingin nyo sir, kayo lang kayang mag-neurologist, kaya ko rin yan. So naging neurologist ako. Then years later, I saw him sa conference. Nilapit ako siya, sir, alam nyo kayo yung reason ba't ako naging neurologist? Then I proceeded to tell him the story. Tapos bigla siya napatingin sa malayo, talaga, I hope I didn't discourage a lot of people. So, tuloy nyo lang yan. Hi, Dre. Actually, I'm not a neurosurgeon. I am an internist and I'm a neurologist. So, dalawang specialties ko, internal medicine, which deals with adult diseases, and neurology, which deals with medical treatment of disorders of the brain, spinal cord, nerves, and muscle. So, ang difference niya, ang neurologist, hindi siya nag-opera. Medical treatment lang kami. And then, kung kailangan ng operasyon, i-refer na namin sa neurosurgeon. I was 35 when I was inducted as a fellow of the Philippine Neurological Association. Kaya medyo late kasi after med school, internship, boards, nagpahinga ako isang taon, and then I had 3 years of residency training in internal medicine sa Medical City, and then 3 years of neurology residency training ulit, and then boards again. So I was 35 when I became a full-fledged neurologist. I will encourage you to be a neurosurgeon. Kailangan natin ngayon nun. So I think 5 years yon, 1 year of general surgery and 4 years of neurosurgery. So see you around! Hi Dots MJ! Ito na po. Sasagutin ko na po yung tanong nyo. So ang pre-med course ko was BS Psychology in UP Diliman. So, ang totoo niyan, basta ma-fulfill mo yung mga science subjects na requirements sa med school, kahit ano ang pre-med course mo, pwede. Ako nga, mutik na akong mag-theater arts na pre-med course eh. Pinigilan lang ako ng mama ko. So, yung isa kong kaibigan, actually, philosophy major siya. Yung iba, mass comm. So, iba-iba talaga. Advantage, actually, pagdating mo na med school, parang pare-parehas kayo eh. Konting advantage lang, for instance, siyempre nursing, pag clinical na kayo, yung mga medtech kapag sa mga laboratory works, tapos yung mga pharma, pag pharmacology subject, but that's just one subject in med school. Other subjects, halos pare-parehas kayo na baseline na talagang blank slate kayo. Kaya BSI pinili ko kasi medyo relatively easy siya compared sa ibang mga pre-med. Kung mahirap na nga medicine, magpapakahirap pa ako sa pre-med, so mas madali na sana. Sanay lang kami sa research sa psychology. Hello! Hindi ko matiis na hindi sagutin yung ibang comments kasi if I can encourage even one of you to continue your studies and to go on to med school, then sobrang sulit na ng pagsagot ko sa comments. So Clyde, how do you deal with self-doubts? Normal ang mag-doubt sa sarili. Don't be too hard on yourself. To me, self-doubt is a sign of humility in a way. Sabihin, marami ka pang hindi alam sa sarili mo, you doubt yourself. Instead of letting it drag you, let it uplift you. So you tend to strive for something more. So, hindi ko to alam. Ano pa bang dapat kong alamin? Alam ko na ba lahat ng dapat kong alamin? You have to find that passion deep inside you and see kung yung course mo ba is para sa'yo talaga. You have to find your purpose. Your purpose is not to earn accolades or compliments from your professors or good grades. In medicine, your purpose, your sole purpose is the patient. Hello! So, tutuloy ko yung sinasabi ko dun sa part 1 about yung tips to study medicine. So guys, I will give you three important traits to have when you want to study medicine. At wala dun ang talino. Yes, hindi kasama ang talino dyan. Well, of course, maganda yung grades mo nung pre-med para mas makapasok ka sa school na gusto mo later on. Pero to stay in med school, then you need these 3. 1, grit. Tapang. Kahit anong unos iba to sa'yo, go ka lang. 2, sipag sa pagbasa. Lahat tayo may same number of brain cells. At lahat about med school, natututunan yan if you just read. Well, definitely kung medyo ayaw mo magbasa, medyo mahirap yon. 3rd, empathy. Just always think of the patient. So, bawat turn ng page mo, I say this to all my students, isipin mo na lang, bawat turn ng page mo, may masisave kang buhay in the future. Hey, negative! At masaya yung delivery para parang ma-negate yung negative na name. Average medical student, nako guys, kung nakita nyo lang yung transcript ko ng med school, hindi siya ganun katataas din yung grades ko. I would say medyo slightly above average, but hindi ganun kataas like 90s above yung neuroscience. Don't be too fixated on grades. It's actually the process of learning. That's what's important. Actually, sa specialty board exams namin, hindi importante na makuha mo yung correct answer and correct diagnosis. Ang ina-assess sa'yo yung process of diagnosis, how you arrived at it, rationale mo, how you process things. So when you finish your residency training in neuro or neurosurgery, you're actually just a competent specialist. Alam mo kung kailan kayo gagaling? Kapag nagpa-practice na kayo, pag marami na kayong cases nakikita, you're building up on your experience. But I think the most important thing is, kailangan marunong ka makirelate sa patient, and that's the art of medicine. Hello, Sadir. So, tingin mo talaga ma-inspire ka pag narinig mo yung NMAT story ko? Okay, so I took the NMAT as the same with all the other batchmates when I was third year ba? Or fourth year pre-med. So, nasa UP kami noon. And syempre, alam mo naman sa UP, medyo competitive yung mga tao. This was in the mid-90s. So, actually, nung time namin, hindi pa uso yung mga review centers eh. Actually, I didn't enroll in any review center. Parang sa group namin kasi sa college, hindi talaga uso yung mag-enroll ka sa review centers. So, self-study. Medyo mayabang pa ako doon kasi sabi ko, supposed to be NMAT is a review na lang ng mga pinagdaanan ng mga subjects, basic subjects. Naalala ko nga sa physics, ang ginamit kong book was yung high school book ko ng physics. Yon. Tapos yung iba, parang feeling ko dapat recall na lang to. So, nung nag-NMAT kami, actually chill lang. Pero nung lumabas na yung scores namin, sa barkada ko, actually medyo nahiya pa akong sabihin yung score ko. Kasi parang nagmukhang ako yung pinakamababa. Before I say kung ano score ko, let me just also say na ang context namin nito is UP Psych, mga geeks yung mga friends ko, ang tataas na expectation, dapat at least 98, hindi bababa sa 99, 98, 99 yung scores mo pag NMAT. So talaga pa ma-inspire kayo dito, baka naman mas matakot kayo sa kikwento ko. Anyways, sa standards ng UP, my NMAT score of 93 or 95 was really low. Hi guys! I had been reading the comments, and yes, I read all your comments. And medyo nalulungkot ako dun sa kwento ng iba na hindi sila makapag-medicine because of the fact that they still have to support their families or may mga responsibilities sila sa families nila na hindi nila maiwan. Hindi ko alam kung ilang taon na kayong nagko-comment, but I'm guessing baka early 20s to early 30s. Nakakalungkot because I cannot imagine having a dream and not fulfilling it. I'm not a licensed clinical psychologist and I'm not a psychiatrist, although we did have some rotation in psychiatry during my training. Maybe I can share with you some of my experiences na makatulong sa inyo and to encourage you. Grabe ang hirap mag-advise. So we all know this Filipino culture that we have, that we are very family-oriented. But I do hope you guys are not having codependency issues. So codependence, ito yung mga taong hindi masyadong pinaprioritize yung sariling pangangailangan, kundi mas iniisip yung iba. The point na yung mga decisions sa buhay is naka-center na sa ibang tao o sa ibang bagay at hindi siya makadesisyon on his own. Marami ako naging pasyente na naging codependent sila. And later on in life, they develop really bad anxiety attacks or syndromes, depression or mixed anxiety depression. Yung iba high functioning, hindi mo mahalata, nakangiti, they're functioning well, they're working, pero yun pala, they are suffering inside. Please make sure that doesn't happen to you. It isn't fair to yourself. I'm usually practical pag nag-advise. Ang masasuggest ko lang siguro is, kilalanin mo mabuti yung sarili mo para mas mahalin mo siya. Loving yourself doesn't mean you're being selfish. Loving yourself is choosing to be happy. Sana pumunta sa puntong you're helping your family but you're also resenting it at the same time. Do not give more than what you can afford to give. You see, if you love yourself more, then you'll be able to give more to others. You also need to set aside some income for your dreams and for your future family. Not ever feel guilty for thinking of yourself. Being psycho-spiritual about this is atin, love your neighbor as you love yourself. How can you know how to love your neighbor if you don't know how to love yourself? Be the author of your life. What specialties to take? So maraming medical students nag-iisip na kung anong specialty ang titake nila. Yung iba pre-med pa lang. Ganito kasi yun guys. Actually, maiiba pa yung gugustuhin yung specialty as you go through with your training. So pa nag-clerkship kayo or internship kayo, depende dun sa rotations nyo, dun yung makikita kung saan kayo nararapat. So sa ngayon, ang influence natin nagagaling usually sa mga napapanood din natin, sa mga naririnig nating kwento, sa mga preconceived notions natin ng isang specialization. Pag namimili tayo ng specialty, bibigyan ko kayo ng guide questions para ma-simplify. So anong gusto natin? Yung nag-oopera ba o yung hindi nag-oopera? Kung hindi ka nag-oopera, yung tipong hawak mo lang stethoscope, okay na, ready ka na to practice anywhere. Second set of questions, hospital-based ba o hindi hospital-based? So, syempre, yung hospital-based, dun lang sa hospital ka dapat mag-practice kasi hindi available yung gamit na kailangan mo outside. Dun sa hindi hospital-based, you can practice anywhere. Basta may lamesa ka, may ballpen ka, meron kang prescription pad, stethoscope, BP app, okay ka. Third set of questions, may emergency ba or walang emergencies? So, syempre, kung may emergencies, ito yung tipong drop everything. Pag tinawag ka sa hospital, kailangan nandun ka na agad. Kasi hodang meron kayong family events or whatever, you have to go to the hospital. Usually, ito yung may mga surgical procedures. Kung wala kang emergencies, mas medyo relax ka sa time mo. You kind of own your time. So, usually, dermatology. Ayusin ko lang muna yung salamin ko. Okay. Next, may patient interaction ba? Or ayaw nyo ng patient interaction? So, may mga specialties na hindi masyadong patient interaction. Like radiology, pathology. Although pag tinawag sila for frozen sections, kailangan nandun din sila. Meron namang sobra yung patient interaction like psychiatry, specialty ko, I am in neurology, and most other specialties, syempre kailangan ng patient interaction. So pansin nyo ba sa set of questions ko, hindi kasama yung mabilis kumita o yung mabagal kumita? Kailangan pa bang tanungin yun? Parang no-brainer. So yung mga questions na yan, pwede kong i-discuss later on sa future videos on the financial aspect of medicine. Tsaka na yan papasok. For now, ang importante is during your clerkship and internship rotations, dun yung mafe-feel kung anong specialty dapat para sa inyo. So, depende dun sa set of questions, mga sagot nyo doon, at dun sa feel nyo ng rotations ninyo. Have fun with your journey. Hi, Ruch. I hear you. So ngayong pandemic, mahirap nga naman for the interns, hindi sila makapag-rotate sa hospitals kasi very risky. What can you do? I think let's use a bit of neuroscience. What I can advise you is you can use visual imagery as a form of mental training. You can do this around 30 minutes a day, even. A lot of studies found that actual execution and imagined execution is same lang ang inactivate na processes sa brain. They're activating the same pathway. So alam nyo, ng clerkship, nag-observe lang din kami eh. Mostly passive din. So wala namang pinagkaiba yon sa motor imagery or visual imagery. But here's one tip. What you do is you imagine yourself doing the procedure. That's what we call kinesthetic motor imagery. See, first person. It's better than observing another person doing the procedure. So first person perspective sa imagery versus third-person perspective, mas maganda yung activation ng brain kapag nasa first person. More of the left hemisphere is being activated. And not just the motor connections are activated, pati yung mga sensory parietal lobules. So nagpo-form ka na ng functional networks on the dominant side of the brain. So you can try that. Next, practice your analytical thinking. Every time you read your textbooks, imagine nyo there's a patient right in front of you. And imagine nyo may problem siya na kailangan nyong isolve. Using the concepts that you are studying. Kung hirap kayo, you can use Siguro people in your life, family members or friends nyo, mga ganon. These mental training techniques can help develop your confidence and lessen your anxiety. So the next time you see patients, mas confident na kayo. Mas madali na yung learning process. It's not enough to know what you need to know. It's more important to find out what it is you still do not know. Happy learning, guys. Christine, actually gusto ko maintindihan yung context mo. Kasi, bakit ka nagme-medicine? Ikaw ba talaga may gusto ng medicine or somebody else wants that for you? Kasi sa totoo lang, mahirap matapos magdoktor kung hindi mo talaga siya gusto kahit kaunti. Kung pinilit lang siya talaga sa'yo. Kasi, hindi siya simpleng course. After ng medicine course, after mo maging full-fledged doctor, maraming buhay na nakasalalay sa'yo. It's one job or one profession na kailangan 150% or more ka pa kung may maibibigay ka talaga. Higit pa sa pwede mong maibigay. It entails a lot of sacrifices and giving up a lot of things that you love right now. You have to love medicine with such a passion in order to study it effectively. So, importante, what I would advise is pag-isipan mo mabuti, ano ba talagang gusto mong path? So, paano ma-ensure na maalala mo yung dapat mong maalala, especially kapag emergency situations? Remember the 2 R's, repetition and redundancy. So, sa med school, importante yung paulit-ulit at importante din yung redundant, yung mga inaaral mo. Naaral mo na yan noon, aaralin mo ulit, aaralin mo ulit, aaralin mo ulit. When I had my specialty boards in urology, I read textbooks as in front to back 3 times yung Adams. All my textbooks, not less than 3 times. And then when I see cases, as in paulit-ulit ko siyang inaaral yung pathway, yung processes, treatment methods. And I'm sure you know why. Because when the time comes, we cannot afford to be mediocre. We cannot afford to forget. Buhay po ang nakataya.